Good afternoon. My name is Michaela Etheridge, and I'm a student nurse at the University of South Alabama, and I'll be performing a wet to dry dressing change today. So the first thing I'm going to want to do is verify my patient orders. I'm going to want to verify my hospital policy, and I'm going to want to get all of the equipment that I'll be needing to use for today. Then I'm going to perform hand hygiene. And I'm going to verify that this is my patient using two identifiers. So, this is Mr. Jaguar Jones, and his MR number is 417-6352, and he is allergic to penicillin. So, everything matches up on my patient care form and my patient's wristband, so this is my patient. The next thing that I'm going to want to do is provide privacy for the patient by closing a curtain or a door and making sure that they feel comfortable. And I'm going to want to explain everything that I'm doing to the patient today so that they don't have any anxiety about it and they feel good about what we're going to do. Next thing I'm going to want to do is raise my bed. The next thing I'm going to want to do is move my trash can next to me or in front of me so that I don't have to turn around and throw something away because that will break sterility. Then I will perform hand hygiene. Then I'm going to want to raise the bed to a working height and lower the side rail so that I can work adequately and reach the patient. Then I'm going to want to position the patient comfortably. This wound is on Mr. Jones's hip, so he will most likely be on his side for this. Next thing I'm going to do is put on my goggles. I don't have goggles here with me today, so I'm using my glasses as goggles. But normally I would have some goggles in the hospital setting. Then I'm going to put on my clean gloves. And I'm going to want to remove the tape and the ABD pad from the patient. I'm going to remove it gently and pulling towards the wound so I do not cause any pain for the patient and I don't mess anything up. So I'm going to remove that and check the drainage on here. I'm going to check for taco, so the type of drainage, the amount of drainage, the color, the consistency, and if there was an odor. Then I'll take out this and I'll take out the inside gauze. I'm going to want to assess the wound, so I'm going to want to assess the wound size, and I'm going to want to assess the type of tissue that's inside the wound with percentages. So a percentage of granulation, which will be the pink healthy tissue that we want to see, and the any necrosis, slaw, or if there's an odor. Then I'm going to want to palpate around the wound to check for any heat, redness, edema, or any tenderness for the patient. Because if the patient had any of those, it will probably indicate an infection. Then I'm going to want to dispose of the ABD pad and my dirty gloves down towards the trash can, throw them away. Next thing I'm going to do is get my sterile field ready. I would like to point out that my table is below my waist, so every time I reach down and grab something off the table, I am breaking sterility, but it's all I have. And normally in a hospital setting, the table would be up higher, so I wouldn't have to break sterility. First, I'm going to take out my sterile field, and there's a 1-inch border that I can touch, and the rest is going to be the sterile field. I'm going to want to dump the contents onto the middle, making sure not to touch, and making sure that they're well away from the 1-inch border. And then I'm going to grab my normal saline, check the expiration date, palm the label, open up the saline, and slowly pour it in so there's no splashback onto the sterile field, and to not touch the container to the basin to keep it sterile. I'll close my saline, put it to the side, and then get started donning my sterile gloves. I'm going to open the package away from my body, and I would need to keep my hands above my waist and out, but since my table is below my waist, I am breaking sterility. So I'm going to want to open it up, keeping it away from the 1-inch border. I'm going to want to do my dominant hand first. So I'm going to grab the inside of the cuff and put my dominant hand in the glove. Only using the cuff. To pull it down and keeping it up and away from my body. Then I'm going to put on my less dominant hand. I'm going to keep this thumb up and use these fingers to do it. And I'm only going to want to touch the inside of this glove with my less dominant hand. Only touching the cuff and pulling it down. Then, once I'm done, I can fix the fingers and pull down. Next, I'm going to want to put all of my gauze into the normal saline. Put it in. Then I'm going to assess the suture. I'm going to assess if there's any drainage or redness. I'm going to assess the approximation of the edges, and I'm going to assess the size of the wound. Then I will grab my gauze, drain it out, and clean the suture. Without touching the patient with my gloves, I'm going to clean the middle, throw it away. I'm going to clean the right side, throw it away. And I'm going to clean the left side, throw it away. Then I will take a dry gauze and gently pat it dry. Then I can start with the wound. I'm going to take my gauze and I'm going to wring it out, wring the water out of it. And then fluff it out. And put it in the wound until the wound is filled up. Just puff it out. Put it in the wound. Next, I will take a dry gauze, set it on top of the wound. Then I'll grab my ABD pad, only touching the blue line on the outside, laying it down on the patient. Then I will take off my sterile gloves, grabbing the outside of this one, then using skin to skin on this one. Down towards the trash can, and taking them off. Next thing I'm going to do is grab my tape, and I'm going to tape up the wound. All four sides to make sure that it's down. would get a piece of tape, write my name or my initials, the date and the time, so that the next nurse who comes in and does this will know the last time that it was changed. Then I'm going to want to lower the bed, and position my patient back into a comfortable position, and then I will raise the side rail. I will make sure that they have the call light near them in case they have any trouble or need help with anything. Then I would perform hand hygiene and dispose of all of my trash. Then I would leave the room and I would go document everything that I learned. So I would document the drainage that was on the ABD pad and gauze. I would document all the tissue that's inside the wound and the size of the wound. And I would also document everything about the suture, the approximation of the edges, if there's any drainage, or if and the size of the wound. And then I would go about my day.